Hi guys, welcome back to the EC Physio YouTube channel. Coming up is another top-notch bike fit video this week. This cyclist came in complaining of pain to his left ITB and tension to the base of his neck with longer rides. He presented with a shorter left leg and associated left hip dysfunction. He had very tight hamstrings bilaterally. His saddle was also adjusted too high, which accentuates his pelvic rocking. Notice how his left hip reaches down on each downturn of the pedal stroke. When we look at how his posture is from the side, we start to notice a lot of posterior pelvic rotation. This means he rolls his pelvis backwards, which rounds out his upper and lower back. This increases the demand of his muscles of his low back and also stresses the muscles of his neck since he has to place his neck into more extension. The ability to tilt your pelvis into either a neutral or anterior tilt will come down to the saddle that you sit on. While tilting the pelvis forwards will decrease strain on your lower back and neck, it also increases pressure on your perineum. The perineum is a rather sensitive area of soft tissue containing blood vessels and nerves that supply the urinary tract and genitals. A saddle that provides support on your bones and offers a design which offloads the perineum will enable a rider to roll their pelvis forwards. A lot of the time, though, riders end up posterior tilting their pelvis subconsciously to offload the perineum. Another reason for one's lack of ability to rotate the pelvis forwards is inflexible hamstrings. If the handlebars are too low and the hamstrings prevent the pelvis from rotating forwards, then the spine ends up flexing and taking on more load. So we corrected for some of the things we found in our visit, the usual things like adjustments to the cleats fore and aft, the stance width, a shim to his left cleat for a leg length difference. We lowered the saddle height a bit and adjusted the fore and aft of the saddle. We also raised the handlebars up. From the back view, he sits a lot more stable on the bike with less motion of the pelvis side to side. From the side view, he sits with a more neutral pelvis. This places a more gentle curve to his upper and lower back, which will also provide more comfort for his neck. As always, thanks for watching. I'll see you next time.